Flexibility is the ability to move a joint through its complete range of motion. This is crucial during everyday activities, movements, and sports. However, tissue damage may occur if a movement passes beyond a joint's range of motion. In this video, we will be performing 5 different types of flexibility measurements: Canadian trunk forward flexion test, YMCA sit and reach test, chair sit and reach test, straight leg raise test, and Thomas test. The equipment needed will be a sit and reach box, yardstick, tape, folding chair, 18-inch ruler, goniometer, paper, pencil, and a mat. Begin by instructing your client to perform a short warm-up prior to testing. It is recommended that the client refrains from fast, jerky movements, which may increase the possibility of an injury. The sit and reach test has been used commonly to assess low back and hamstring flexibility. The client's shoes should be removed before beginning the test. The client will now sit with the soles of the feet flat against the flexometer or sit and reach box at the 26 centimeter mark. If a box is used in which the 0 point is set at 23 centimeters, which in our case it is, subtract 3 centimeters from each value from the table we will be using. The inner edges of the soles are placed within 2 centimeters of the measuring scale. Be sure the client keeps the hands parallel and does not lead with one hand. Fingertips can be overlapped and should be in contact with the measuring portion of the sit and reach box. The client should exhale and drop the head between the arms when reaching. The client will slowly reach forward with both hands as far as possible, holding the position for about 2 seconds. Make sure the knees stay extended and that they breathe normally during the test. The test is scored by measuring the most distant point in centimeters or inches reached with the fingertips. The best 2 trials will be recorded. For the YMCA sit and reach test, a yardstick will be placed on the floor and tape will be placed across it at a right angle to the 15-inch mark. The client will sit with the yardstick between the legs with legs extended at right angles to the tape line on the floor. Heels of the feet should touch the edge of the tape line and be about 10 to 12 inches apart. The client will now perform the test using the same procedures as a trunk flexion sit and reach test. Refer to the following tables for the trunk flexion and YMCA sit and reach test to classify your client. Many older individuals have difficulty performing sit and reach tests due to functional limitations such as low back pain and poor range of motion. The chair sit and reach test is similar yet will only measure one leg, therefore reducing the stress on the spine and the lower back. Place the holding chair against a wall for stability and have your client sit on the front edge of the seat. The client will extend the leg being tested in front of the hip with the heel on the floor and the ankle dorsiflexed approximately 90 degrees. The client will flex the unrested leg so that the sole of the foot is flat on the floor, about 6 to 12 inches to the side of the body's midline. With the extended leg as straight as possible and the hands on top of each other, palms down, the client slowly bends forward at the hip joint, keeping the spine as straight as possible and the head in normal alignment, not tucked in with the spine. The client reaches down the extended leg, trying to touch the toes, and holds this position for 2 seconds. You will now use the ruler parallel to your client's lower leg and administer 2 practice trials followed by 2 test trials. The scoring for this test will be as follows. The middle of the big toe medial aspect at the end of the shoe represents a 0 score. Reaching short of the toes are recorded as minus scores. Reaching beyond the toes are recorded as plus scores. Record the best score to the nearest half inch. The Thomas test assesses the flexibility of the hip flexors. We will begin by having the client lie supine with the back compressed against the floor. The participant will bring one leg, the contralateral leg, or the leg that is not being tested, in the direction of the chest just to the point where the lumbar spine is snug to the floor. If the tested leg remains in contact with the floor during the movement, the hip flexors then are flexible. If the tested leg rises, its hip flexors are likely to be inflexible. Record whether the hip flexors in the right and the left legs are flexible or inflexible. The straight leg raise test assesses the flexibility of the hip extensors. Begin by having the client lie supine with the back compressed against the table. The tester will raise one of the client's legs while ensuring that the other leg remains extended and flat on the table. To measure this, we will be using a goniometer by placing its axis on the greater trichanter, measuring the angle of range of motion. A minimum angle of 80 degrees is acceptable for this passive straight leg raise. An angle of 90 degrees is more desirable. Record the angle and report whether the range of motion of the client is acceptable or unacceptable.